Good afternoon, everyone, and welcome to the Sign Institute of Policy and Politics Summer Series, Sign of the Times. I'm Amy Dacey. I'm the Executive Director of the Sign Institute. And at the Sign Institute, we're a laboratory for university-wide collaboration and an incubator for policy innovation. We convene the best and brightest in the public, private, academic, and nonprofit sectors, as well as journalism. And this program is only possible by a generous gift from our alumni, Jeff Sign and his wife, Samira. Today's topic is the path to recovery. What is the true state of the U.S. economy? And it couldn't be more timely. We'd like to take a moment to acknowledge our co-sponsor for this event, the Kogod School of Business at American University, and to thank Dean John Delaney for his support. And also especially thank you for some distinguished leaders joining us today from our Board of Trustees and alumni board members. It's my pleasure at this time to introduce the people who will be leading this incredible conversation. Sylvia Mathews Burwell is president of American University and the first woman to lead that institution. She previously served as the 22nd Secretary of the U.S. Department of Health and Human Services. She also served as the Director of the Office of Management and Budget. And she has also served as the President of Global Development Program and Chief Operating Officer at the Bill and Melinda Gates Foundation and President of the Walmart Foundation. She's joined today by Gary Cohn, the former director of the National Economic Council and chief economic advisor to President Trump, the former president and chief operating officer of Goldman Sachs, and possibly most importantly, Gary is an alumni of American University and receiving his BSBA from Kogod School of Business. I welcome you both, and President Burwell, I'm sure you're ready to start the conversation.
I am, and Amy, thank you for that introduction and your leadership of the Sign Institute. And we're excited about this conversation today. Gary, thank you so much for joining us. Gary and I share American University. We also share the National Economic Council, where I spent some time a little while ago as well. And so I'll just get us started, but we're going to focus on the economy. But before we focus on the economy, Gary, I think we kind of need to start with the trajectory of COVID-19, because right about now, these things are so interactive in terms of what that means. So Gary, can you kind of start us off with talking a little bit about where you think the trajectory of COVID-19 is? Let's maybe look at it on a 6-month basis, and then where you think we are a year from now.
Well, first of all, Sylvia, thank you very much for having me, and thank you very much, American University and Sign Institute, for hosting this today. Look, I hate this question because, look, I acknowledge right up front that I'm not a doctor, I'm not an epidemiologist, and to have any view of really where we're going in the U.S. economy, you have to have a view on the virus. They're inextricably linked right now. And if you get anything wrong on either side, you're going to make a mistake. So, look, we are in a position we did not think we would be in the middle of July. You know, we all felt, or we all heard, or we were all told, I guess we were all told because none of us really know, that the virus would sort of subside during the summer months, but we needed to be prepared for a second wave come, September, October, normal flu season. It seems to me that we're still in a prolonged first wave, and in fact, we're reaching record highs in infection rates in the first wave. And so I think that's changed my thinking. I think it's probably changed your thinking as well, having talked to you recently. It's changed all of our thinking on where we are. So you, as a president of a university, have to figure out, what are you going to do to reopen your university? And we'll talk about that in a minute. And I'm trying to think from an economic standpoint, the fundamental basics of, are kids going back to school at a primary level? Are they going back to school at a secondary level? Are parents going back to work? Can they go back to work? Or are we going to continue to be in a work at home environment? Because the economic forecast on people going back to a somewhat normalized work and education life versus the abnormal world we're in right now is completely different. So it looks to me, unfortunately, and I wasn't in this position 3 or 4 weeks ago, that it looks to me that this infection rate showing no signs of giving up is going to force a lot of the academic institutions at all levels to take an approach they did not want to take. It looks like employers are going to have to take an approach they did not want to take. And we're going to continue in the stay at home, work at home, educate at home economy longer than we thought, which means that economic growth is going to be slower, that the small businesses that really drive our economy are going to continue to suffer. The big unintended consequence that we have learned about and we're now dealing with from the corona crisis is really the small businesses in this country. 60% of jobs, 60% of businesses, small business in America. But what we did, and look, there was no malice intended in what was done here, is we deemed certain businesses in this country to be fundamentally important and essential. And we deemed many businesses to be non-essential, even though they did somewhat the same thing. And the large, big, international, global businesses we deemed essential, and the small neighborhood businesses we deemed non-essential. So the global businesses got to stay open and they got to sell us the products we needed, even though their core was food and medicine. And we put the small local businesses that sold us clothing and all the other things that those essential businesses sold us, and we told them they needed to shut down. And as the longer those businesses are shut down, the tougher it is for our economy to recover. So this is a tough predicament, and Sylvia, I think you're in this position, and it'd be interesting to see how you're thinking of this as you face a really tough decision and a predicament at trying to open a big academic institution.
Well, it is related, Gary, in terms of the initial question, what do you think is the trajectory of the pandemic? And this harkens back to some of my old background in terms of, what you build, what you're going to do for the university on that. And like you, I was more optimistic earlier in the summer in terms of where we could be and the possibilities. But I do think that some of the fundamentals still hold. And the fundamentals that still hold that can help us from a health perspective and then therefore help us from an economic perspective are the basics of a pandemic are prevention, detection, and response. And I don't think we've ever everybody kind of, let's all get on the same page. These are the three things that we all need to focus on. And we as individuals need to do our part. And as governments and institutions, they need to do their part. And as we think through those fundamentals, if we can get those fundamentals to a place where you can contain the spread of the virus, and that has to do with one of the things that I don't think we all talked about, the trajectory of the virus. We talked about flattening the curve, but we weren't really specific, I think, in helping and being specific that what you need to do is you need to get to the place where you have reduced community spread. What's community spread? We all throw these words around and everybody now uses these words, but the real deal is that we got to get to a place where the spread is occurring in a way we actually know how and why it's spreading. You have to have a small enough number and you have to know where the cases are coming from. And so that means you have to get the caseload down pretty low so that when an individual gets COVID-19, you have tested them, you isolate and quarantine them, and you contact trace so that you prevent the additional spread. And so when you get to that stage, you can start to contain. And that's what we're seeing in other countries. That's what we're seeing in some places in this country, that you get the caseload down. And how do you do that? Prevention. We all just have to wear the masks. That's a part of it. I mean, we know that this is a highly transmissible virus, that it is spread through, even our breathing and our talking. Double masks present, that is a great protection that we can have. The distance of 6 feet, another great protection. And because sometimes the droplets from our breath, our sneezes, our talking can land on things, continuing to wash those hands. When we do that and combine those things, I think we can get to a place. And that leads to, at American University right now, we are on a path. We have cut in over half the number of students that we will have in residence on campus because we're only going to have one student live in a room in terms of trying to meet these basic preventative conditions. We're going to put in place attestation so that people are answering these questions, these important prevention questions. And so we're going to be, from a residential perspective, a much less dense institution residentially And then the other part that we're going to do is we're going to continue to telework as much as possible so our staff doesn't add to the density. Keep that density as low as we possibly can. And then from a course perspective, we're doing a blended approach, which means some students are going to choose to stay where they are and they can take that class online. How we do the face-to-face will be in a changed and more limited fashion. So that's how, for me, connecting those two pieces in terms of it. And on the economy, I think you're giving us a picture that COVID-19 is going to still be a burden to the economy. And how do you think about, where the economy is right now, where markets are right now, and where they'll be in about 6 months?
So just to finish the first thing, it's hard to believe sort of 100+ days or 4 months later, we're still talking about tests, hand washing, and masks. It really is hard to believe it. I mean,
so,
but we are, and we haven't solved the basics of test, hand washing,
test.
Test.
That, and on the tests, I think there is an important thing I'm afraid we need a national approach in terms of the scale and approach to testing, because with a virus that is so transmissible and we have community spread, tests can't just be a diagnostic tool. Diagnostic means I go to the doctor, I think I have strep, they test me, that's a diagnostic tool. That's how we're using the test, versus the tests actually have to be a part of surveillance, understanding where we are, because we have so much spread. And that's why you need these tests, and you need access to the tests. And the other thing is you need access to tests on a timely basis. I think most folks know that now the number of days it takes to get your test result goes up. Well, during that period of time, people are not isolating if they don't know. And you can't.
Let me talk about the market. So it's the most asked question I get. And I always, if I'm in a one-on-one conversation, people tell me they don't understand the value of the market. And so I always ask them, what do you use as your benchmark for the market? So with the use the Dow, I remind people it's 30 stocks. If they use the S&P, I remind people it's 500 stocks. We don't have an index for small family, women, minority-owned businesses. If we had that index, it would be trading at all-time record lows. The indexes that we quote are the Dow, the S&P, the Russell, the NASDAQ 100. They're all very small indices. And the key here is they're all market cap weighted indices, meaning that the bigger you are, the bigger your weighting in the index. So literally there are a few companies right now that are dominating the performance of the stock market. So when we talk about the Dow or we talk about the S&P, we're really talking about, in essence, a small handful of companies today. And we all know who those companies are. And by the way, those companies have become more important in our life than they ever have been, because we can't live without them in this COVID, work at home, stay at home, live at home world. They're companies that provide us connectivity. They're companies that provide us food. They're companies that provide us services. And in essence, like I said before, we've made these companies bigger. We've given them more market share than they ever could have thought they would have had. We've made them more essential than they ever thought they would be. And we've done it, unfortunately, at the expense of small businesses. So when people say, I can't believe, based on the economic conditions that I'm seeing right now, that the stock market's at record highs, I say, look, I don't have a problem with it. Because when I look at what's going on with the companies that drive the value of these stock markets based on their market cap and their weightings, it makes some sense to me. And they are companies that we all need to deal with. There is a disconnect between market cap weighted indices and non-market cap weighted indices. Just taking apart the S&P, which is basically unchanged for the year, at least it was at one point yesterday. And if you took the 500 stocks in the S&P that's unchanged and just took it on a 500 stocks, you would have over about a 10% difference in the returns in the S&P by demarket cap weighting it. So that's how important it is to see how these indices are calculated. The fundamental economy is really in a precarious position right now. The federal government stepped in early and they did what they needed to do. They provided enormous amount of stimulus money at a variety of different levels. They provided enhanced unemployment because, look, we told people, we need you to stay home to fight the virus. That was one of our lines of defense. So initially we did the right thing. We knew small businesses need to shut down, so we provided PPP loans. We spent $3 trillion in stimulus money to try and get ourselves through the virus initially. Whether it's fortunate or unfortunate, most of that money is running out right around now, the end of July. The enhanced unemployment benefits are running out. We've extended PPP, but you can only take the money once. So most companies that have been eligible for the money, that wanted the money, have taken it. We as a country, we as a legislative branch, we as a federal government, we as a citizens, we have to decide, are we gonna re-up these benefits now because the virus is still here, or are we not? I think we don't have a choice. I think we have to do a second round of stimulus. We're gonna have to give more money to small businesses because we're not allowing small businesses to open. We thought they'd have a chance to open during this lull in the virus, and then there'd be more decisions in September and October. We're not allowing people to go back to work. So these businesses are gonna need the federal stimulus. On top of that, we still haven't dealt with a couple of the basic fundamental facts. We threw enormous financial burden on the states in this country. We asked the states to step up and pay for a lot of healthcare costs that they weren't planning on paying for. We asked them to pay for a lot of unemployment benefits that they weren't planning on paying for. And simultaneously, most of them lost the vast majority of the revenue because the revenue comes from sales tax. And a lot of them stopped collecting sales taxes. So we need to get the states back to the financial position they were in pre-virus. I'm not advocating getting them back to a financial position they were in a long time ago. Get them back to where they were pre-virus. And on top of that, the hospital system and the healthcare system in this country, contrary to what you might think, you said, oh, look, we've had a big healthcare event in this country. The medical system and the healthcare system must be in great financial shape. It's actually the complete opposite. The healthcare system in this country is in dire financial needs. Most medical systems in this country were forced to shut down and be in a position to only treat COVID and COVID-related illnesses. They shut down what we call, elective surgeries. I'll remind everyone that most elective surgeries, if they're happening to you, are pretty essential surgeries. You would not consider them elective surgery. If you're having a tumor removed or a cancer is removed, or you've shattered your knee and it's being rebuilt and you're in a wheelchair, you would not consider that elective. Our medical care industry does consider that elective because it's not life-threatening. And we needed to, for a short period of time, make those hospital beds available. So we need to get our healthcare system back in a financially strong place to do that. So look, I think we've got to go with another round of stimulus. Sylvia, I don't know if you'd agree with that or not, but it seems like we're not going to make it through the next 3 months without the legislator getting involved.
I agree, and I actually think that the other part that needs to be considered in terms of actions by the Congress actually gets to the things that will help us fundamentally contain the virus. And whether that's the funding for the testing infrastructure that we need as a nation. And that doesn't mean that it's not the same in every place. What it means is that the principles and the ability to access the testing, that we have enough. When we have, LabCorp and Quest, their capacity right now in terms of the testing, how are we as a federal government thinking about supplementing and figuring out how we have the capacity for testing? So the one thing I would say is, yes, I believe we need to do things on the economic side, but I would consider doing the right things that we need to do in terms of ensuring that there's testing capability, ensuring that there's contact tracing capability, ensuring that the states have the ability to support people and places in doing the isolation that's necessary to keep things contained, to reduce the level and keep things contained. That would be the other part of what I think needs to be considered as we go forward.
What about on the you've got a background on the mental health side? No one talks about the mental health side of what's going on here, and the kids not getting the protection they need, not being seen, and teachers being a first line of defense, especially in the primary education system.
So, you know, I think two of the things as we consider legislation that we need to make sure we're considering, and you touched on one of them, I think in a related way, two of the things that aren't front and center. It's becoming that way though. Mental health is number one, and two is basic health care. That, you know, the number, we are measuring COVID deaths, but we're not measuring as closely and carefully the deaths that are occurring because people aren't having the procedures that you were talking about, that people, even if they could have the procedure, they're concerned and don't go because they don't want to be exposed in a hospital setting to something. And so those two things are also two things I think we need to focus on. On the mental health, I actually think the mental health issue is an issue that is across the board. From our children, we have a 10 and 12-year-old here at home, through the college students and what we see at American University in terms of the increased need to the parents and everyone, and to our elderly who are, you know, the number of elderly, when you talk to people who have elderly parents that are dying during this period, the fact that they can't see people leads to more decline more quickly. And so it's across the board, I think, the mental health issues. And I think we should think about this as a real opportunity to think about taking that next step in mental health. There's something called the Mental Health Parity Act, which was making mental health, it's exactly, this is one of those things where the legislation actually is what it does what it says in terms of trying to make sure that there's parity between your physical health and your mental health, in terms of how we pay for it. In terms of its prioritization. There were steps in the Affordable Care Act that also moved mental health forward in terms of that kind of coverage that people need. And so I think this is a real opportunity to think through what we need to be doing in a situation that's acute, that I think we're going to be seeing the results of this for an extremely long time. And whether that's things as simple as a university, our counselors can't provide telehealth services to a student. We're in Washington, D.C., and a student flew back to California and they were in counseling at AU. We can't provide the services, but is there some way that there can be a waiver of certain licensing restrictions for a limited period of time with certain constraints so that we can continue care? So there are many things I think we can do in the mental health space.
Yeah, no, I have a daughter that teaches in the New York City public school system in a fairly poor neighborhood, and she's just worried about her kids getting fed. You know, how do her kids get fed? And she considers herself a first line of defense to make sure kids are healthy and safe. And she literally is worried about, she teaches fourth graders, you know, how those kids are surviving. A lot of them live in one-room apartments. New York City public schools did a good thing and made sure each family had one iPad, but some of them are 4 kids in a small 1 or 2 room apartment sharing one iPad, trying to go to school online with probably not high-speed internet. I don't know what that leads to, but it surely doesn't lead to a robust education system at the most important years when kids are in 4th grade and really the core learning years.
Yes, and I think that that point kind of brings in this question of how COVID-19 has laid bare both racial and economic inequities.
Yep. And
you know, there's the situation that's in front of us, and then I think there's the question of what does that mean from a policy perspective as we go forward. And in terms of the situation that, you know, has been laid bare, I think in front of us is that we see the incredible inequities in terms of who's bearing the health burden and who's bearing the economic burden of COVID-19, and whether that's in the health space where we know that our Black community, our communities of color bear a disproportionate burden of the mortality and the illness of COVID-19. And that is related to another issue that the country is focused on, hopefully in a real way to make change, which are issues of racism and structural racism. Because what's happening is these are communities that have health disparities and historically have, that are related to those issues. And now we see COVID-19 with more deaths, more morbidity, more sickness and illness. We also see economically these communities being disproportionately impacted because they're the jobs that are essential, and they're also the small businesses that you were referring to in terms of the places that cannot, are not bridged what you were describing is we've got to have policies that help us bridge through this period. But I don't know if you thought about the inequities in these spaces and the policies that we should be thinking about. You talk some about now, but also in the future.
No, you can't go a day without thinking about these policies. We knew a lot of these issues were out there. I mean, like, none of these issues are new to us. For those of us who served in public policy world, we knew a lot of these issues existed. So that's the good news. The bad news is we've never been able to solve them. Look, and we knew they existed in the corporate world as well. We've never been able to solve them. COVID has really brought home the reality that we don't have a choice but to solve some of these inequality issues in the United States right now. Whether it comes to education, comes to healthcare, jobs, opportunity, access to capital, we don't have a choice anymore. And look, I very firmly believe it starts with education. That's why I bring up the example of, kids in New York City. Yes, the city gave them an iPad, but 4 kids in a one-room apartment with slow internet, it's not exactly an environment where they're going to be able to learn. And so getting kids back to school is really important. But it's just one of the pieces of the puzzle. We have to continue to figure out better ways to make the system work for everyone. Education is important. Access to capital. Look, the idea that we've got the most robust financial markets in the world in the United States. We're the home of capital markets. If you asked me to list a competitive advantage in the United States, I would list the breadth and depth of our capital markets, and that people come here from all around the world to start new companies. And one of the reasons they do that is because of our educational system. And the other reason they do that is because we've got access to capital. And we do that for foreigners, and we can't even do it for people domestically born here. And the inequality plays into that card, into that hand. And so we have to figure out ways to get people better education, keep them in the system, and make sure people understand there is capital, and our financial system is going to provide capital for anyone with great entrepreneurial ideas.
Yes, and I think we also, as we're doing that in terms of those inequities, also recognize, and solve the problems that racism is an additional problem for many that we have to resolve, and that adds the criminal justice system and policing that we've seen as a nation in terms of, as we think about those changes. As we think about that, focusing on that access to education across the board, and particularly during this time, how do we get young people back in the economic sphere? How do you think about the questions? I don't want to use loaded terms because I think social safety net comes with a picture and words. So let's not use those words, but how do we think we make our economy, and when making our economy, we're making the economy of individuals resilient to more challenging times? Because that's one of the things I think we see relative to other countries, that they have mechanisms for resiliency in ways when they have downturns, even if they're not COVID-19 downturns that are this extreme, that you can get through those. The economy, and the economy means basically individuals' basic economic well-being as well as the overall economy. Are there thoughts you have about how we think about keep making our economy more resilient?
I do. And look, the COVID experience is probably a once in a long lifetime experience. 1918 was the last time we had something like this in the United States. So it's a 100-year experience. But that said, it's not the first time we've had to deal with something like this in the United States, which does put us on notice as a country that we now have to think that potentially every 100 years, and by the way, these viruses don't know what 100 years is. They could happen in 2 years. We now have to think as a country, how can we be prepared for these viruses? And one of the things I've been talking a lot about lately, and this fits in with the economic picture, it fits in with the jobs picture, because I think our whole economic picture and jobs picture is going to change based on what we've gone through in the last 4 months, is we have spent enormous amount of time over the last 100 years plus in the United States talking about our military security and our international security and protection from enemies foreign and abroad. We've never really talked about domestic security in this country. We've never really thought of protecting our citizens day in and day out. And I think we all come away from this virus, and we're not done with it, thinking differently about domestic security. What does it mean to have a secure supply chain of, a new word for 2020, PPE, personal protective equipment? So how do we make sure that we manufacture in the United States or stockpile in the United States enough personal protective equipment that it would never be an issue? It would never be a newsworthy item. We should never be in a position where we're talking about personal protective equipment. How do we manufacture or stockpile enough drugs in the United States that we're never at risk to have to worry about a foreign country cutting off a drug supply to us because we're worried about our domestic safety? How do we in the United States make sure we ensure our food supply, that we never have to worry about a food supply? You know, look, in this crisis, from some respects, it was Clorox, it was Lysol, it was toilet paper and paper towels and napkins, things that were, you know, I would say need to have, nice to have, not have to have. No one was going to starve to death. But the next crisis will be different. So I think we now, knowing what we know, we have to sit down and say, okay, if we're going to be domestically secure, we have to do the following things. And the following things are, you know, a lot of infrastructure on food, a lot of infrastructure on medicine, personal protective equipment, transportation. There are a lot of intricacies in this, which is going to create a whole new set of jobs in the United States. All we've done in the United States, and I'm not saying all this negatively, all we've done in a very positive way for the last 80 years in the United States is create more and more service jobs, less and less manufacturing jobs, and less infrastructure jobs. I think that trend has come to an end. I'm willing to declare that that trend has come to an end, and we're going to go back now. We're not going to get out of the service business. It's still our core competence, but we're going to go back and create some more manufacturing, some more infrastructure, some more supply chain jobs, knowing that. How are we educating people in our country? How are we preparing people for those jobs that will be available? We're going to need to entice companies to come back and do that here in this country. How are we enticing our workforce to be able to fill those opportunities? I think that's really important.
I think as we think about that pandemic preparedness from my old life at HHS, I think we all need to understand that the likelihood of pandemics and things that spread become greater and greater in terms of, you know, the issue that, you know, these are sometimes passed from animals, you know, it's animal to human transmission, then does it alter and have human to human transmission? And that the idea of pandemic preparedness, the idea that it was 100, you know, basically 100 years since the last one, I don't think that's what we should be preparing for. And I think we have to think about, if you think about even World War II, and did it bring our economy to its knees in the way that this has? And we need to think, I think, to secure the nation about being ready and being prepared, and what does that mean as we think about this threat to us, both from a health perspective and an economic perspective. And I think to your point, another space as we were thinking about how do we make the economy more and our nation more resilient is the question of healthcare and access to healthcare, which is an incredibly important thing and has led to lack of access to healthcare, has led to people having more of the comorbidity, the conditions that make this this particular virus, but most viruses, when you're compromised in a respiratory way, you have diabetes. These are all things that for most viral infections, for most diseases, that you're more susceptible to mortality or other problems. And so as we think about some of the things and places that we do, that we put in place the things that can protect and care for people as we move through these things, including things like how we think about the food issue. And, you know, we have things that we refer to as counter-cyclical. In other words, they expand during the bad times because they help carry people through and bridge them when we're having these challenges. And whether that's access to food through assistance like supplemental nutrition programs that we have or others. And I think we need to pair all of these things together to get to a space where we are more resilient as a nation and think about these issues. It's interesting to hear that probably it sounds like if I asked you, what's the biggest thing that you think economic change will come? It won't be working from home. It is increase in manufacturing. Would that be how you think about that in terms of what biggest?
I do. I think we are going to have to change our supply chain infrastructure in the United States, which is manufacturing. So whether it's PPE, medical equipment, supply chain, yes. So that would be my single biggest change economic. Number two, and it's close, we now know as a country that at any moment in time, Congress is going to need to spend $3 trillion in stimulus money. We've never had that in the back of our mind. And I don't think Congress has ever had that in the back of their mind. I don't even hope, I pray that when the new Congress is set in 2021, that they approach both the revenue side and the expenditure side of the federal government differently. They should look at the way we spend money, and they should be more diplomatic and thoughtful about the way we spend money. And we're going to have to look at the taxing system in the United States, and we're going to have to change the taxing system. We're going to have to collect more revenue in this country because we now know that we just can't keep spending more and more money and be prepared for one of these maybe 100-year events, but it might be a next year event as well. So those are the two big takeaways I have from an economic standpoint when I look back at what we've learned over the last 4 months. And you, what do you agree with those or disagree with those?
The manufacturing part of this is something that, my time actually all the way harkening back to the National Economic Council work in the 1990s that I had the chance to work on in that time in terms of starting some of the seeding of the manufacturing capability. And then that was continued through the Department of Commerce when I served a second time. So the idea of creating that manufacturing capability, I think is an incredibly important thing that we need to think. I think we really do have to think through these issues of the stockpile, what it means. We have a stockpile. Much of that had gone aside as we had done that, and many of the investments in local public health, which we know we're depending on so much, you couldn't get those funded in both of my times in government. So the manufacturing and our capabilities internally, and the infrastructure point, has been a point. Even as trying to negotiate in the OMB times when I was there, the idea of infrastructure as part of a big deal, I think is actually very important to how we'll move forward as a country. And I think we just have to think about it in innovative ways. It is about our roads and bridges and the core infrastructure that we have. But infrastructure now we know is related to technology, and being from a state like West Virginia, making sure that there's broadband. When I have gone to check on my mother and to do telework, in West Virginia, making sure that there is that capability, and that's important to the overall economy. So I agree that I think we're going to have to think through that. On the issues of our spending, I think, Gary, and you and I have discussed, I was fortunate enough to be at OMB, my first time at OMB, and the deputy director when we had 3 balanced budgets, and how we think about the importance on the revenue side, as you said. And I think what's important about what you said, Gary, is we have to think about both sides. And that's what we all have to, think through the right ways to do things. I think right this moment, we're not at a moment where, to the point of the stimulus and what we need to do, we need to think about how do we most effectively get money to the right people in the right ways to keep the economy going and to help us solve our healthcare issues, and to really understand some of the many things that people are suffering right now in terms of the economics. I think so many of us are protected from knowing about the people who have had the economic hits, and those at the lowest level. At American, what we've tried to do with any of the changes we've done, we've tried to protect all of our employees who are 40K and below. they'll still get their merit increases. They will not have their retirement payments not made, so that we can think about those are ways that the private sector and not the government can take actions, but we need to think about that, I think, across the board.
Yeah. Look, I totally agree with you. Now is not the time to cut spending. That's why I said it's a 2021. Hopefully it's a 2021 event.
Yes.
Look, I said earlier, we're going to need another stimulus package. We've got to get through this. But there is going to be a time when we get to the other side of COVID, and we're going to be talking about it in past tense, not present tense, where Congress is going to have to take a deep breath, reflect, look back, and look at the financial side of this. Also, I'll add one of my pet peeves. We as a country have done a absolutely horrific job on infrastructure. We do a very good job talking about it, but we have never, well, I don't say we've never, in the last 20 years, 25 years, we haven't sat down with a master plan and said, what do we want our infrastructure to be? When we spend money, we basically do maintenance on what we have. We fill potholes, we fix guardrails, we fix falling down bridges. We haven't sat back in 20 years and said, okay, this is what a modern developed economy should have. And let's go out and figure out how to do it. And a point of that is we're the only modern developed economy in the world that doesn't have high-speed rail. Think about that. Think about the effect of high-speed rail. It solves so many problems. It's green, it's environmentally friendly. It gets congestion out of airports. It gets congestion out of skies. It moves people efficiently. It allows parts of the country to open up. I won't go on about high-speed rail, but it's hard to believe that we don't have a high-speed rail network in this country because of all the benefits. You take places like Japan and China, they figured it out instantly, that this is the way to move people efficiently.
A long time ago.
A long time ago.
Certainly for the Japanese.
Yeah, absolutely.
Gary, before we turn to everybody else's questions, I think Amy's going to moderate those for us. Can you say, right now, we've talked about some of the hard things. You're working on a lot of different issues. Can you say, what are the two things that excite you most right now in terms of what's in front of us and in terms of the opportunity side of things?
So look, I do think when we get to the other side of COVID, we're going to have a unique opportunity in this country because we're not going to have to. So if it's a get to, we won't do it. What I've learned in Washington, and you can reflect on this, we're not very good at getting to do things. We're pretty good when we have to do something. Washington reacts when it has to do something. We're going to have to take a deep breath, reflect back, and decide where we're going in this country. Because so many important issues that you and I have been talking about have been raised in the last 4 months, whether it's the healthcare system, the inequality system, our inability to be prepared for a pandemic or a crisis, the future of small, medium-sized, minority, family-owned, women-owned businesses in this country, the larger companies getting larger, our inability to maintain our medical system, PPE. I could go on and name things, but we're not going to be able to ignore all those things. So in many respects, we're going to have to reflect back on where we are and re-engineer a bit of our economy going forward. That doesn't mean that we're going to isolate ourselves from the world. I think it means a bit of the opposite. We're going to need to import more of the non-essentials and manufacture more of the essentials here. And it's going to be more of an interesting relationship with our allies around the world. And I think there's a really interesting opportunity for that. So that's from a big economic perspective. From a secondary perspective, one of our core competencies, and I talked about this earlier, our technology industry here in the United States just continues to thrive. And what we're creating and what we are going to create that people don't know about yet. And some of the companies that I'm involved with and other people are involved with and the products and things that they are going to bring into the retail market, they're nowhere, they just don't exist right now, over the next 3 to 5 years are nothing short of extraordinary, whether it be on the personal security side, making the personal phone unhackable, making your emails unhackable, to the artificial intelligence side, to what we can predict and how we can predict behavior and how we can predict trends, to all of the payment system. Are we going to be in a cashless society? Are we going to be able to basically do our taxes and have everything just be done digitally for us? Is everything just going to be automated for us? Sometimes those are scary when you talk about it. And on the other hand, it just levels the playing field for everyone and it makes the country better. So look, I come away from this kind of excited and pretty optimistic once we can get to the other side. Between here and there, I'm kind of scared because no one's really able to predict what's going to happen, and the unknown is pretty scary right now. I don't know. Do you have some?
So I probably my optimism and I'm an optimist by nature, and I would I would say 3 places where I am optimistic that there can be positive change, and positive change that pushes off of where we are right now in terms of COVID. And I'll do 3 because I was at McKinsey many years ago, and you do it. And the first, the 1 and 2 are very, well, they're all related, but the idea that in both education and healthcare, that we can move the ball on access, affordability, and quality. That the nimbleness that we have seen in terms of what we had to do, what we were forced to do, that we need to learn the lessons of what are the things to take away from that. And that's not that online education. I mean, I believe firmly that residential face-to-face education for our young people who are 18 to 22 is a first choice. If that can be, that is a first choice. But I think we also understand that for those that are on a trajectory that may differ, you need to think about things differently, and we can think about things differently. So improving access, affordability, and quality in the education space, in the healthcare space. I think we've learned a lot about telehealth. There were always so many barriers to getting it done. And now I think we also, I think, are going to see the value of certain in-home care that perhaps, there were great hurdles to kind of get over. And so the issues of access, affordability, and quality in the healthcare space, it's another place that I'm optimistic. Can we look at these lessons? Can we see what this has taught us about, no, there are some things you really need to do face-to-face, and you really need to do those well, and you need to do them in certain ways. But what are the things that technology and other things can help us with in terms of getting to a place of those things? And then the last issue I would just say is I'm hopeful. I think it's hard, but I am hopeful that this will be a seminal moment with regard to the issues of race in our country, and the recognition that we all as individuals, and those of us who are leaders of institutions, need to take aggressive steps that have not been taken in the past. So those are the 3 places that I would say that the current challenges leave me in a space of optimism that what we are learning and experiencing can lead to real change.
Great.
Amy, I think we're turning it over to you.
Well, this has been an incredible conversation. We've had so many questions come in while you were talking, so I'll get right to it. The first question is actually from Kelly Marie. She is a Kogod student and actually a Gary Cohn Scholarship recipient as well. She asks a question, I think, because of both of your experience in the public sector. Just this great question. It has been discussed that a one-size-fits-all solution might not be the answer in this time. So how do you see Congress and the administration creating solutions for our country while different states and cities exist in drastically different health and financial situations?
I'm happy to go first. And, this issue of the differences in the nation, I mean, you can imagine when you're Secretary of Health and Human Services, the difference in what it takes to provide rural healthcare to what it takes to provide urban healthcare in terms of access, affordability, and quality. Because, you can imagine that the challenges are different in each of those settings. And I think what, the question reflects is what we need to do when we're making policy and when the public and private sector work together, however we're doing that there are core principles and core things, but how those get applied to different situations, whether that's rural or urban, just as an example, there are many others, that what you have to do is think about the application of them at that level. And so it's getting everyone on the same page with regard to the core principles that you want, which is, do you want access to healthcare for everyone? If you do, what it takes to get it in a rural setting may be different than it is in an urban setting, and be ready to create ability to get to implementation in perhaps different paths and different ways.
Gary, we had one come in directly to you from Jeff, that we've had such a great conversation talking about what's happening in the US, but we don't exist in a vacuum. So, you know, certainly his question looks for the global perspective. How do you see US-China economic relations moving forward? Is there a great unwinding coming, or where do our traditional allies fit into this conversation about the US economy?
Well, this should come as a shock to no one. I was always the globalist in the White House. So I am very much of a free trader, very much of a view that we are part of a very important global economy. And we have globalized, and we should stop debating that. We're not going to nationalize. We're not going to put the genie back in the bottle. And knowing that and understanding that China's biggest economic issue is full employment for 1,400,000,000 people, we should use that to our opportunity, to our best advantage and opportunity. We can import a lot of goods that China can manufacture a lot cheaper than we can in the United States, but they're going to need to be the non-essential core goods. We're going to need to make sure we've got a supply chain that protects us on the essential core goods. And therefore, if we're importing non-essential goods from China at a lower price than we can manufacture here in the United States, we are then creating more service jobs in the United States, because people, once they buy those goods from China, will have more disposable income to buy services here in the United States. I believe that, I preach it, and I don't think that's ever going to change. And we should stop fighting it, and we should embrace it, and it's going to work out well for us, and work out well for China, and work out well for Europe.
This one is certainly for the both of you. It comes from Elena, who's also a Kogod student as well. She said, as the country has reopened businesses, the number of COVID cases has increased. So do you think that will cause the economy to backslide, or will we continue to rebound? It's such a unique experience, she says, having an economic and healthcare crisis happen at the same time. So how are these interrelated, and what do you see for the future?
I'll go first this time. Sylvia went first last time, so then she'll be next. So look, we had a healthcare crisis, and we decided, and by the way, I'm not questioning, this was the right decision. We created the economic crisis. We decided the best way to fight this virus was to literally shut down our economy, tell everyone to stay at home, tell everyone not to go to work, shut everyone out of school. We conscientiously made that decision. Now, what we didn't know at the time is how long that would be. I think the basic assumption was that that would be a relatively short period of time. And so if you looked at the PPP benefits or the enhanced unemployment benefits, or a lot of benefits that were created, they will end, they were scheduled to end, some were extended, some end this month. So we self-created the economic situation justifiably to try and stem the wave of the COVID crisis. And what you're finding in real time, that probably was the right decision, because as certain states have reopened and liberalized, they've had a major uptick in virus. So we are finding, back where we started, you know, masks, hand washing, social distancing, and testing was the right answer. We just didn't execute it long enough and efficiently enough to let the virus completely leave. And now we understand how powerful this virus is, and how, what the R squared is, basically how many people one person can contaminate, and how this virus can explode.
I'm happy.
You have something to add for that one?
No, we can go on to the next one, so we'll get
Okay.
to questions.
Great. Well, this one is great. I love this question because I think it's on so many people's minds. Christopher's asking us, there's a lot of discussion about when things will go back to normal versus what changes today will become the new normal. So how do you think that this debate will be reflected in the economy over the next few years? Are we going back to normal, or are we seeing a whole new normal? I don't know who wants to take that one first.
Sylvia's turn.
You know, I think that we're going to be in a place where I think the impact of COVID, you know, even if we have a vaccine that starts to be rolled out in a, the best predictions are something being rolled out in the new year. I think there are a couple things about that. That will be a vaccine that probably will not be, I think people think vaccine and they think 100% effective. I think FDA has said that they will approve something that's 50% effective. So you need to think about what that means. We'll be scaling the vaccine for those who need it most, healthcare workers, and those most at risk. And so I believe that the time period from a health perspective and a economic perspective, I mean, we're looking at 2 years of something that I think no one would consider normal in terms of what we have historically known. I think that there will be key elements that, as we were talking about where there are opportunities, that there will be some changes that occur over a period, you know, that are going to be different and hopefully better. As we do our learning. I think saying exactly what those are, you know, this question of will more people telework? You know, I think we know it is an option and an opportunity. Will we invest in our manufacturing and infrastructure? You know, I think those are some of the things that we're going to see that will be different over time. Will there possibly be more blended or hybrid learning in different forms? Probably yes, in terms of some of those tools. So I think we're at the cusp of seeing which of these things, because we need to learn. I think we need to pay attention to what works, what doesn't work, what's needed, what's not needed. And I think we're in the early stages of that analysis. Gary?
Yeah, no, I agree. Look, we're going to have a new normal. We're not going back to where we were. I agree with that.
Right. Well, here's a fun one for you, Gary. Somebody asked, what was your most memorable moment at AU? Is there something you could tell our students that'll be coming back into the fall about the great things about American University?
Yeah. So I was involved in the student government, and I took the university to federal court to enjoin them, the board of trustees, for raising tuition.
Thanks, Gary.
Yeah, you're welcome. Well, it was like a 14% tuition raise in 1 year. And the way AU works, because in Washington we had to go to federal court, so it was kind of fun. But that was also 1981, but you know, a long time ago. I
didn't start the conversation what year you graduated. I just mentioned.
No, I figured I could throw it out there. I can handle it.
Okay, here's a good one, Gary, for you too, because of your expertise. Tim asks, where do you feel the stock market will be in 6 months, 12 months, 18 months? Is this so volatile? Are we going to be able to see in the indicators as we kind of move forward?
Well, look, it's difficult because, as I said earlier, the stock market right now, market cap weighted, is representative of so few companies right now. I believe those companies are going to continue to be very, very important, and those companies are going to continue to do well. So the stock market as an index-based valuation could be higher and probably will be higher. That doesn't mean that the vast majority of companies in this country are doing well. And as I said before, the index of family businesses, small businesses, minority-owned business, women's business is not going to be doing well. So no one should conflate the stock market with the real Main Street economy, because they're not the same right now.
Gary, what do you think unemployment will be January 1, 2021?
January 1, 2021. Look, my view is we're going to be arguing if it's a 2-digit or 1-digit number. And so I think it's going to be either side of 10. Because like I know, so my funny line is I know how to get to 10%, down to 10%. I don't know how to get below until you really get small business, Main Street America, entertainment, restaurants, movies, sports and entertainment, hotels, conventions, parties, conferences, till you get those up and going. I don't know how you get that other 10% of people and travel going.
Well, I'm afraid we've run out of time. We've got so many more questions. We could keep doing this for sure. I want to thank both of you so much for your time and your expertise today. I also want to thank you, President Burwell, for your incredible leadership for all of us on campus as we prepare for the fall and students coming back. I'd like to extend an in-person, when we get to that place again, Gary, for you to please come back to campus. We'd love for you to meet with the students and do that as well. For everyone who joined us today, there's more programming coming from Sign. We encourage you, please, to go to our website, sign up for our newsletter. A lot of these programs, including today's, will be recorded and available on our YouTube channel. And we will certainly in the days and weeks to come do follow-up. But thank you again. Once an eagle, always an eagle. Gary, thank you for your time. And again, President Burwell, thank you as well. Enjoy, everyone.
Thank you.
Thank you.
Thanks, Gary.